We have a great show for you all today. We're getting started here in our LCMC Health Wellness Lounge with a conversation about back to school. Yes, it's important to do the school supply shopping and of course do some back to school clothes shopping, but it's also important that we take our children to the pediatrician for a checkup. Today, we're talking about what that checkup looks like and the importance of it. Joining me now here in our lounge is Dr. Nailah Gallego Clemmons from Children's Hospital, New Orleans. Welcome to the show, darling.
Thank you.
Yes, and happy back to school season to everyone out there. It will be here before you know it. I'm so glad we're talking about this because I remember every year right before school, my mom would take us to the pediatrician. But I'm so curious, is back to school time really the best time for a checkup, or should we start January 1st?
So it depends. Usually back to school is generally a good time. Oftentimes that's when the schools usually ask for those forms to be completed. If it's been greater than a year since that form has been completed, the families definitely need that form to be updated. And it also depends on the child's birth date. So if the birth date falls along, say, June 1st, then that's definitely a great time. But if it's January 1st and they've gotten those forms completed early on, that's okay too.
Yes, no matter what though, it's important to get it every single year depending on their age. When people go for a checkup, we're talking about a physical exam here. What's all included in a physical exam with a pediatrician?
That's a great question. So growing up, I used to think it was just going to see that doctor and getting that form completed, but it's so much more than that. So one of the things, we do the exam, so it's a head-to-toe assessment. We check the child's vitals. We also track how they're growing as well, and we check in with the family to see about the child's eating habits, their sleeping habits, how things are going in school, as well as their physical activities. And we also do screenings at these visits as well, along with vision and hearing. Sometimes, depending on the child's age, we also check an anemia or a lead screen, cholesterol screen as well, and sometimes schools require tuberculosis as well.
It's become so much more since I've been in school and you've been in school. You all are seeing what a physical exam looks like on your screen right there. Now I'm curious, is a physical exam and a physical the same thing, or are they different? Because you know, a lot of people who are going to be in athletics, they have to get a physical as well.
So we do use the terms interchangeably pretty often, but an actual physical just includes the actual exam, and usually it is a requirement for sports, but sometimes the sports exam can be done with the actual annual physical or wellness check.
And how often should somebody be getting a physical? Yearly, but what if they're maybe a younger age?
So typically starting at the age of 3, checkups are done every single year. Before that, it's a little bit more frequent. So that first year of age, it's about every 1 to 3 months. And that second year of age, it can be anywhere between 3 to 6 months. So more frequent in the first 2 years and yearly after the age of 3.
Of course, especially if somebody who is new, 1 month, 2 months, 4 months, 6 months, and the list goes on all the way up to 36 months because they're new to the world. They don't know everything that's out in the air, you know? And I'm curious, as we become teenagers, do you all as pediatricians start looking at even more things, or is it more of the same that we got when maybe we were 9 years old, 8 years old?
We do look at more things when they become teenagers, and at that point we also have an opportunity to talk with the teenagers themselves. We do ask mom, dad to step out the room to talk about more of the sensitive topics. We are concerned about their mood at that point, peer pressure as well, so we do address different things at that age.
And I feel like a lot of times when parents go into the doctor's office, especially a pediatrician who is looking at their child, they're the professional in the room. They're going to make sure everything is checked and asked. But parents also need to be aware as well of what the doctor is going to be doing. What are some questions that they should ask the doctor if they don't automatically do it already?
So usually during the well visits, the pediatricians have a number of questions that we ask. So we do address a lot of things, but things that the family should bring to our attention are if they see any changes in their child's behavior or development within the past year that they have concerns about. Other things, if there's like any difficulty with vision or hearing, the child may not bring that to our attention, and the vision and hearing tests aren't done at every single visit. So those would be things to bring up to the child's doctor.
And what are some common things that you all see in children when you do an annual checkup?
So things that we usually see, let's start with the screenings at first. So the vision and hearing screens that we do in clinic are screenings. So sometimes we do need to refer out or have the child see an eye doctor.
That happened to me. First grade.
It does happen, and sometimes it's just a screener. So they need a more accurate exam by an eye doctor just to make sure they don't need glasses or any additional care. Sometimes that hearing screen can also be abnormal as well. Oftentimes we do see earwax in children's ears, and that can affect the hearing screens too, but usually we can either repeat it or refer out to an audiologist.
It is so important. At the end of the day, we need to get our checkups, parents, because we want our kids to thrive in the new school year. Doctor, thank you so much for being here. I appreciate you so much. And look, everybody, if you have more questions about this topic, log on to chnola.org. Now look, coming up tomorrow, Dr. Clemmons will be back because we're talking about vaccinations, a very important topic.